I'm Lian. I'm one of the emergency medicine residents. So we do many types of procedures regularly in the emergency room. Not only do we get to do them in the emergency room, we do them off service. I think part of the ICU experience is really helpful in that you get to do these procedures in a more controlled, slower environment, and you do ICU months early on in residency. So you get to practice them there, and then in the emergency room when it's a little bit more chaotic, you feel confident. Also, as an intern, frequently the senior residents pull you in to do procedures with them, so even from day one, you're getting exposure to all different types of procedures. I think working with all of the attendings has been very supportive, and it's really up to you to tell them how confident you feel for small things like lac repairs and things like that. Early on, they might just tell you how they might do it, and then you get to do it on your own and then see the end product, and then they let you fly very early where you're doing all of this on your own, and they feel confident that you can do that. With more in-depth procedures or more rare procedures, again, they're there as much as you want them to be. If you feel confident in running the whole thing, you can ask them to be like, don't step in unless I'm asking you to, or you can have them be as hands-on as possible. And then at the same time, you always have higher level residents that are also there that are guiding you through these procedures. And as a resident, you kind of go through being the learner and then becoming the teacher, which is also really helpful in developing your skills for these procedures. I walked recently one of our interns through doing a central line, and it was definitely a new experience for me because I'm used to just doing them on my own, but seeing someone else, how they do it, how they approach it, and the technique really made me think about what are my steps in setting up for this, and what's my technique, and why is it that way? Why do I do it a specific way versus how they feel comfortable doing it? And so it makes you analyze how you do things too. For the more complex and rare procedures, we do them during our sim labs. We have mannequins that we can practice these more complex and rare procedures on. And then we also have a cadaver day where we do them on cadavers. And going through the motions makes it feel more prepared for when the day eventually comes that you have to do a rare procedure.